It's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered. And in last week's episode, I shared another question in this series of questions from my client, Veronica. And the question last week was part 10 of my 71-year-old dad is in intensive care with stage 4 lung cancer and stroke. He's on the ventilator now and in an induced coma. What are his chances of survival? You can check out last week's episode by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer the next question from one of my clients, Veronica, which are excerpts from one-on-one phone and email counseling and consulting sessions with me. And the question this week is part 11 of my 71-year-old dad is in intensive care with stage 4 lung cancer and stroke. He's on the ventilator now and in an induced coma. What are his chances of survival? So in last week's one-on-one counseling and consulting session with me, we talk about why Veronica's dad, quote unquote, only has single organ failure and not multi-organ failure, and why the distinction here is important. I also explained to Veronica how the ICU's bed occupancy is impacting on her dad's treatment and care. Furthermore, I shared with Veronica how a service like intensive care at home would be advantageous for her dad and her family. So let's dive into this week's counseling and consulting session, where Veronica writes, "Hi Patrick, I have watched the video, what are the risks and benefits of a tracheostomy? I wanted to share this info with my other family members first before we have the meeting with the respiratory consultant and the ICU consultant later today, if we decided to do this for dad. Would it be best for my dad to have a tracheostomy done before they wake him from sedation in his situation, as he will need the suctioning? Or is it better for him to make that decision when we wake him up? I'm concerned he will get stressed again when he cannot breathe and cough up mucus. But if he cannot talk at all, he might get very depressed. And if he cannot eat, he will be very upset also. This is not an easy decision, and I want time to discuss this with the doctors and my family. How much time do you think we have if they give us the chance to do the tracheostomy? If the doctors agree to this or are open to this, how long can we think about this to make the right decisions? Thank you, from Veronica." So here is my response. Hi Veronica. Most ventilated patients in intensive care needing a tracheostomy will have it done while they are in an induced coma. After the tracheostomy has been done, sedation can be taken off straight away in most cases. In some cases, a trial extubation, which means the removal of the breathing tube, is being done first, and if the patient fails to breathe by themselves, the breathing tube is being reinserted, which is also known as intubation. After the breathing tube has been reinserted, a tracheostomy is being done as a next step. You are absolutely correct that this is not an easy decision at all. It's most likely that your dad will get stressed again if he cannot breathe by himself and coughs up the secretions. On the other hand, yes, a tracheostomy won't enable your dad to talk or eat. It is a catch-22. Given that we are potentially dealing with an end-of-life situation, it is important to weigh up what your dad would want if he can't make the decision himself. Currently, your dad isn't in a position to make the decision himself. I believe, therefore, that quality of life and his comfort levels need to be considered first and foremost. Therefore, comfort care or palliative care needs to be considered also. I'm very happy to answer more questions regarding tracheostomy if you want to discuss. I will be available pretty much any time from now on. The only time I'm unavailable is between 12 p.m. and 1 p.m. So, here is Veronica's response. But before I get into Veronica's response, if you want to get one-on-one counseling, consulting, and advocacy with me, just scroll on the top of the website and click on the links, or give me a call on one of the numbers that you can see on the top of the website, and we can start right away. So here's Veronica's response. Hi Patrick, after we finished the call today at the hospital, the doctor who spoke with us, the ICU consultant, arranged for us to meet with the respiratory specialist. He met us at 7 p.m. at the hospital, and we asked him all the same questions and more. And he also showed us Dad's latest CT chest scan. The CT scan clearly shows the lung is not good at all, and Dad has about half a lung between the two lungs that are healthy tissue. The rest is full of cancer, damage, infiltration, and inflammation. It was really important for us all to see this, and now we understand more about the condition of my dad's lungs. I again asked about the tracheostomy and also the treatment options for pulmonary fibrosis, and he said earlier these pulmonary fibrosis treatments may have helped earlier, but not at this late stage. He suggested we leave Dad sedated and in the induced coma on the ventilator and keep him sedated and then let him go by removing the breathing tube, as this would not cause him so much stress. However, my mum and my brother and now myself agreed to wake him up and see what Dad will do once the tube is out, and they will put him on the BiPAP mask and make sure he's comfortable this way until nature takes its course. The respiratory doctor and the oncologist, who I called after we spoke with the respiratory physician, said he can't treat Dad's cancer anymore, and the tracheostomy will just prolong his suffering, and he advised against it. So all the doctors we spoke to are against the tracheostomy based on the CT chest scan result. We didn't give the intensive care doctors any instructions until we have a sleep on the decision. And we will advise them tomorrow afternoon. We have made a decision now to try to start to take Dad out of the sedation tomorrow night and be with Dad when he wakes up on Friday morning. I'm working half a day tomorrow now, so I can go to the hospital early to let the doctors know what we decided as a family. I'm taking the rest of the week off to spend in hospital with my dad to help and be by his side. Thank you very much for your advice. So here is my response. Hi Veronica, thank you for the update. I'm glad that you were able to get more information now, especially that you were able to get to look at the CT scan. In light of the fact that basically only 50% of the lungs are currently working, a tracheostomy would indeed only prolong the inevitable. I think waking up your dad and see what happens is wise, and being with him will be a good thing. Maybe he can talk and advise you what he wants. I really think it's good to sleep on the decision and then move forward when you and the rest of your family feel ready. With all the information that you have shared with me now, I would imagine that your dad's comfort should be priority once the breathing tube has been removed, and comfort can be achieved with drugs like fentanyl morphine and midazolam. Midazolam is known as a sedative and it will help your dad go to sleep quickly. Morphine or fentanyl are very strong painkillers and they're also known as opiates. The focus now clearly needs to shift to comfort care and palliative care to make sure your dad is not unduly suffering. With all the information you have shared with me for now, and as far as I can see from my experience, your dad is in a real and not in a perceived end-of-life situation. And in case you are wondering what's the difference between a real and a perceived end-of-life situation, I wrote an entire article and made an entire video about this. The difference between real and perceived end-of-life situations when your loved one is critically ill in intensive care. And I put a link towards this article and video, and I put it in the written version of this blog below the video, where you can click on the link that'll get you to that article and video. Going back to Veronica, it's good that you and your family have clarity now, and even though it's very sad that your dad is realistically dying in the next few days, at least you know now what you're dealing with and you can start managing it appropriately. The next step is to look at timelines, which you have already done to a degree. You also may want to prepare the rest of your family what is going to happen over the next few days, and I can help you with that and talk them through it, what to expect. It sounds to me like you want to be there when your dad is going through the last stage of his life. You may want to find out if your mother and your brother want to be there also. Whatever they decide will be fine. Don't judge them for it. Not everybody has the strength and the courage to sit beside one of their family members dying. Don't judge them either way. Next, make sure that all of your dad's cultural, spiritual, and religious needs are met before your dad's passing. This may be very important for your dad and also for other family members. Again, you could still also consider intensive care at home and have your dad extubated and go on BiPAP at home and have him pass away at home. Please also keep in mind that when midazolam and morphine or fentanyl are being started after or before removal of the breathing tube, things can happen very quickly. Your dad may pass away quickly even though he's going on the BiPAP. Morphine and midazolam have respiratory depression as one of their main side effects. Therefore, getting your dad off the ventilator and the breathing tube with less than 50% of lung capacity may get your dad to pass away quickly, maybe within a few hours or so after extubation. It's difficult to put timelines on this, but I'd say from experience, it will probably be hours and not days. The other thing, Veronica, from an ethical, moral, and potentially also religious point of view, is whether you consider giving sedation such as midazolam and morphine as euthanasia, given it'll aid your dad passing away peacefully. It is standard practice in intensive care. Many people, including myself, struggle with the concept of helping people dying. Have a think, and I'm very happy to talk to you today pretty much any time if you want to discuss or have any more questions. So, how can you become the best advocate for your critically ill loved one? How can you make informed decisions, get peace of mind, control, power, and influence quickly whilst your loved one is critically ill in intensive care? You get to that all-important feeling of making informed decisions, get peace of mind, control, power, and influence when you download your free instant impact report now by entering your email below. In your free instant impact report, you learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free instant impact report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free instant impact report now by entering your email below. In your free instant impact report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability, even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You will get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You will get crucial behind-the-scenes insight so that you know and understand what is really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it is not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also check out our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Or you can call me, find international phone numbers on the top of the website. Also, check out our ebook section where you get more ebooks, videos, and audio recordings, and where you can also get one-on-one counseling and consulting with me via Skype, over the phone, or via email by clicking on the Counseling and Consulting tab on the top of the website. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.